Hello everyone, this is Bill Keegan, Town Manager in Foxboro with your daily update on the COVID-19 situation here in Foxboro. Let's take a look at the numbers as they currently exist. And not much has changed since yesterday. The new numbers will be coming out later this afternoon. Wanted to let everyone know that starting tomorrow, I'm going to be actually broadcasting earlier in the day so that I'll have the latest updates that will come out throughout the entire night. And what's been happening is that a lot of information is coming out after my broadcast early in the day, so I'm going to wait until that information comes out, and then I'll report on it to you tomorrow morning. So I'll be planning to do the broadcast sometime around 10 o'clock tomorrow morning, and most likely we'll be broadcasting at 10 o'clock going forward at that time frame. So stay tuned for that, and we'll give you the numbers as they currently stand. In Massachusetts right now, we have 4,955 cases and 48 deaths. In Norfolk County, we have 548 cases, and in Foxboro, there are 10 positive determinations, and there are 3 that have actually recovered. So it's good to see that some people are actually beyond that stage at this point. The greatest age group impacted right now is between the age 50 to 59 years old, with 953 cases statewide. And so we'll continue to keep an eye on those numbers as they develop. Now, listening to the governor earlier today, he went on at 1 o'clock today. He indicated that he thinks that there will be a surge in cases from the week starting on April 7th through the 17th, based upon the latest information that has occurred from their end. So we will continue to see that happen, and we'll continue to monitor that on a very close basis. We have been noticing here that over the course of the past several days, our numbers have been doubling every 3 days in and around the counties. The counties' numbers have doubled every 3 days based upon what we have lately. So as a result of that, we'll continue to keep an eye on that for you. The Health Department continues to maintain a dedicated COVID-19 webpage that may be accessed from the town's main webpage by clicking the Coronavirus tab or going to the Health Department page. On the Health Department page, click on Novel Coronavirus COVID-19 info to find links for trusted information sources and key updates. The CDC has information for talking with your children about COVID-19. The link can be found at www.cdc.gov/2019-NCOV/daily-life-coping/talking with children. And what's really important about that is that as kids stay home, the questions continue to remain: why are we staying home? What's causing all the challenges with this situation? And some of the points about talking with children about coronavirus disease in 2019, it talks about some very good talking points, provides for you as the public conversations around coronavirus disease 2019 increase. Children may worry about themselves, their family, and friends getting ill with the COVID-19 virus. Remain calm and reassuring when talking to them at all times. Remember that the children will react to both what you say and how you say it to them. You will pick up cues from conversations you have with them and others, and indicating if they appear to be worried or if they have a particular amount of anxiety about the situation. That's the time to sit down with them and talk to them in a very reassuring way. Make sure you make yourself available to listen and to talk. So in other words, if you're home and you just want to talk about things, give kids the extra time that they need to talk about what's going on in and around Massachusetts. And don't forget that what you see on the news, particularly as it relates to places like the city of New York and what's going on in the state of New York and around certain areas, some of the hardest hit areas in around the country, in California and Washington State, are not what's going on here in Massachusetts per se. We certainly have a lot of cases, and we don't want to minimize the impact and the significance of what's going on, but they are not in any way the same kind of situation that's going on in those cases. But certainly we want to take every precaution we can here so that we don't have a situation evolve like what's going on in New York. So let's maintain what we've been doing the social distancing, washing our hands, doing all the kinds of things that will make us safe from what's going on in and around the world. Remember that it's really important that parents talk to the kids about not congregating in groups. There are all age groups being affected by this disease. So we want to make sure that we do not allow them to congregate in groups any larger than a few people at the very, very most, to make sure that they themselves are maintaining a good distance when that happens. Make time to talk. Be sure children know that they can come to join you and talk to you when they have questions. Pay attention to what children see or hear on television, radio, or online. Make sure that they're not just spending all their time listening to that information, because that can impact people negatively. I've seen it in my own house at times where we become so focused on the news that we lose sight of what's going on around us, and so we want to try and stay away from that and try and focus on periodic check-ins to see how things are going. Give children the information that is truthful and appropriate for their age and developmental level of the child, and make sure that whatever they get is information that's factual information and from reliable sources, and what we're trying to provide you is very reliable information, so that you can report that out when necessary. The governor spoke today earlier at 1 o'clock today, and some of the main points that he raised was again that he thinks that the peak of this the coronavirus impact in Massachusetts will occur between the week of April 7th and the 17th. They do encourage additional blood donations. Blood donations are at a significant low at this point, and really causing another significant impact throughout the state. So we really want to get folks to continue to donate as necessary, and you can go to the Red Cross website for additional help in locating locations near you where you can make those donations. In no way, shape, or form have there been any indications that donating blood has been a consideration for causing a concern about coronavirus. Only that they have taken appropriate steps to protect people as they go to make donations. So that is not a blood-borne pathogen or one that can be transferred through blood donation. So be mindful of that. Also, the Health Connector the Secretary of Health and Human Services has indicated that the Health Connector will continue to provide services irrespective of the fact that folks are behind in their payments. They'll continue to provide that service and important medical services as the situation continues to evolve. Earlier today, we actually had an important meeting this morning, starting at 8:30. With our COVID-19 task force, and we got around the table and we talked about all the different things that we've been doing here in Foxboro. And I'm pleased to report that based on the COVID-19 guidelines that have been issued to us by the CDC and for the emergency planning steps, we've checked every single one of those boxes. So we're doing all the right things here in Foxboro to protect you, make sure that you're aware that your government is fully behind you and doing the things that we need to do to protect all of you. Over 39,000 tests have been conducted statewide, and that number is increasing every single day as tests become more available and are actually easier to administer. There are new tests coming out. I saw this morning on the national news that there are tests now that the time span is actually shrinking. So we're going to keep close tabs on that, so the information, so the tests can become more easily available to all of us. The administration has proposed in Massachusetts, the administration has proposed to convert skilled nursing facilities specifically to care for people with confirmed COVID-19 cases. Secretary Sutters wrote in a March 27th letter that the state is taking an unprecedented step to establish skilled nursing facilities specifically to care for people with confirmed COVID-19 diagnosis. The Beaumont Rehabilitation Facility and Skilled Nursing Facility in Worcester will be the first site of this kind. The state's new COVID-19 PPE procurement and donation program streamlines the procurement of personal protective equipment for healthcare providers procuring protective equipment for the front lines in a priority effort. Needed equipment includes the N95/N99 masks and respirators, face masks with integrated shields, goggles, protective suits/gowns, head covers, sanitizing wipes, surgical/procedural masks, power air purified respirators, PAPR, gloves, booties, shoe covers, and hand sanitizer. Those are the things that are most needed at this point in time. On a local level, Foxboro is doing its part by has established a collection site at the Council on Aging, which is up and running as we speak, and it will be available and will be open for donations through Wednesday. And then on Wednesday, we'll be bringing donations of that kind to Sturdy Hospital, who is in dire need of that equipment as we speak. And certainly anyone who has any that they would like to donate for that purpose, you can go to the Council on Aging right now and make a donation if you want. Grateful for all those efforts to do that. Another thing that I wanted to mention, this is actually on the good news front. It's always pleasing to see very creative situations involved during times of crisis, and great to see that this one actually came from an 8-year-old girl here in Foxboro. And there was an article. It was a great article in the journal, the Sun Chronicle recently. An article that was dated March 23rd about a young lady by the name of Sarah LaBranche, aged 8 years old and aged 8, a student at the IGO school, and daughter of Foxboro JC Amy LaBranche. Sarah's great grandmother is a Doolittle resident, and Sarah is missing being able to visit her and be in the same room with her because of the COVID-19 crisis, and understands we need to maintain social distancing, but still wanted to make seniors happy. So what they wanted to do was the JCs would like to spread some sunshine and Doolittle home residents in a way that is safe and during this time of social distancing. Rocks will be painted by Foxboro's Young and Young at Heart. Rocks will be placed by 2 JCs at the Doolittle Homes Park along their walkway for their residents to enjoy. And rocks will be accepted until April 3rd. So if anybody would like to paint a rock, the program is called Seniors Rock, an idea to beautify the Doolittle home in the garden with painted rocks made with love. The rocks can be dropped off at 159 Mechanic Street in the box marked Senior Rocks in the blue bin at the front door, if anybody would like to do that. If we can get enough, we would like to drop some off to other senior areas in town as well. They will video when the rocks are being placed so that you can see where yours is being located. And please, please, please do not go and place your rocks on your own. We have assured the Doolittle home that there will be only a few JCs 6 feet apart placing these in that they would like to get a heads up on that before any rocks are placed on the property. They are all observing COVID-19 restrictions and guidelines in doing this, so please be mindful of that. If you have any issue getting your rocks to the drop-off location, please send a message to the JCs, and they will make alternative arrangements for you. So this is a great program that was brought together by an 8-year-old Sarah LaBranche. Sarah LaBrock, I should say. That last name is spelled Labrache. 8 years old, student at the IGO school, who has come up with this idea and was taken on by the Foxboro JC. So great job in doing something really community-minded for the community during this difficult time. Also, Food for Vets is a program that has been put together in cooperation with our local Veteran Service Office, and is a program that's put in place to provide meals for 2 weeks for veterans, 3 meals a day for two persons in a household for 2 weeks, 14 days, and that program is being put together at Gillette Stadium. And the program starting Tuesday, tomorrow, March 31st, and will run through Friday, April 10th. Weekdays from 10 a.m. to 2 p.m. at Gillette Stadium. So anyone who is interested in participating in that program or knows someone that can actually benefit by this program, certainly you want to take advantage of that opportunity. And then other points. Don't forget the Great Bear Hunt for Kids is going on, and that was started by Kerry Olson. And that can be accessed through the Uptown Happenings Facebook page. Make sure that you follow that. That's actually starting to grow and take on a little bit of life of its own, which is a good thing and fun for the town and for the kids. Again, PPE donations at the COA and Human Services Department, located at the Senior Center. And also another good thing to mention is that we had a large donation of toilet paper from Next Gen Supply, owned by a local resident, Larry Stern, who provided a huge donation of toilet paper for those who need it the most. Anyone who is in that situation and truly cannot get out or cannot afford to get some right now, certainly contact the Council on Aging Human Services Department at 508-543-1252, and they'll be happy to help you and see if you qualify for getting some of that free donation that was most generously donated by Next Gen Supply. So again, thank you to Next Gen Supply for making that donation to the town of Foxboro. Those are the latest updates for the town of Foxboro today. I will provide you with a further update tomorrow morning and give you an update on the actual numbers that are occurring here in and around Foxboro and throughout the county. For now, continue to stay safe and stay healthy as we make our way through this difficult time. And if anybody has any questions or wants to provide additional information that we can do during this update, you can email me at bkeegan@foxboroma.gov. For now, take care and stay safe, and I'll see you next time.